First of all, I wanted to invite me to present an overview of food registration in Ethiopia in this, the second African Maternal and Nutrition. My presentation may focus on the registration of MMS product. My outline, it is just the first two topics are an introduction about EFDA, the regulatory body, which regulates MMS products, and the food regulation and the registration process in Ethiopia. But the main focus, which I want to present, is MMS regulation. Is that a drug or a food supplement? And what we face currently as a challenge on the registration process of food supplements and drugs. So just few points about EFDA. EFDA is found under the Ministry of Health. It is established by the Proclamation 1263/2021. It doesn't mean that before not exist EFDA. EFDA was before Ethiopian Food and Medicine Healthcare and Administration Control. The health authority, the health facilities and professional regulated under the EFDA. But currently it is focused only food products, drugs, medicine, medical device, cosmetics, tobacco, and other health products. Its duties and responsibility of FDA is stated on the Proclamation 1112. So MMS products as a food supplement, it is fall down for the regulation under the FDA. Next. Especially the regulation is conducted not only at the headquarters, but there are geographically located 7 branch offices and 15 exit and entry inspection sites. So if it is entered or imported through different branch offices, the regulation activity is conducted by FDA branch office. So just to see the current food safety regulation in the health sector, please. There is a DJ at the head and the special division, especially the Food and Drug Department, Deputy Director General, it leads. Under the Deputy Director General, the food facility, the registration, the quality control, and the port of entry. So at federal level, the manufacturer, importer, exporters, and wholesalers are regulated at the federal level. At the regional level, the retail outlets are regulated by the regional health regulatory bodies. So there is a step, there is an inspection team and division, and at zonal level and at Woreda level. So MMS products should be registered by the Food Registration and Licensing Directorate, and at the same time the quality control checked by the Food Quality Control Lab, and during the importation process, the food inspection team at port of entry checked MMS products. So food registration, what does it mean, food registration? Food registration means having a market authorization, a pre-market license issued to register the food products, ensuring that the quality and safety requirements that prior or before being offered for the public sale. So any product, whether it is imported or locally manufactured, it should be registered or notified. There is a registration and notification difference. I will come back on that issue, but we require both technical and administrative documents to register this product. The main thing is no food product should be being offered for public sale prior to registered and notified. So the registered products are these. There are high-risk food products should be registered. A baby food, food supplements, animal products, sea product, fruit, vegetable, nuts, therapeutic foods, complementary foods, and fortified foods like iodized salt, edible salt, wheat flour. All these such type of highly risk food products should be registered. So for the registration purpose, there is a requirement, stringent requirement, which requires the regulatory body to register that product. And for notification is another requirement. Yeah, When we come to the low-risk food products, just we notified the product. It is like crackers, snack, confectionery, fats, packed water, soft drink, beers, and extruded products, and noodles, and some non-perishable products are categorized to notified product. This is the main thing to require during the registration. So if we registered the product, we require as technical documents the shelf life or stability study report about that product through real-time and accelerated time, certificate of analysis, GMP certificate, free sale certificate, sample of the product, list of ingredients. All these are required for registered product. When we see the MMS should be highly risk products, highly vulnerable group it presents, so it should be registered. For the notification purpose, we are only asking as a regulatory body just a simple of certificate of competency and sample or label of the product. So when we come to MMS registration, thank you. For the MMS registration, MMS is a medicine or a food supplement? This is the main issue. Just to say it is a food supplement, we are using a tool to define whether the product is a food supplement or a medicine. There is a definition in the Proclamation 1112, Article 2, Subarticle 8 and 9. It is clearly stated, food supplement means a concentrated source of vitamins, minerals, or other substance with nutritional or physiological effect alone or in combination prepared in a dosage form and intended to supplement the normal diet. This is the definition of food supplement. So we are clearly stated what food supplements means. So we can judge by ourselves whether the product is food supplement or medicine, because medicine means any substance or mixture of substance used in the diagnosis, treatment, mitigation, or prevention of human disease, disorder, abnormal physical and maternal state, or symptoms. So except any special occasion is happen, the definition is work as a tool to define whether the food supplement and the medicine. Just let's raise one example. Previously, RUTF, ready-to-use therapeutic food, is categorized as a food supplement. But currently we receive a letter from WHO through to Ministry of Health of Ethiopia, and Ministry of Health of Ethiopia is request just to categorize ready-to-use therapeutic food as essential medicine. When we see the product itself, it has a nature of a food because the product is prepared from skimmed milk, peanut butter, different legumes. At the same time, this product is used to treat malnutrition. So there is a borderline. Some products are in the border. They are a food nature, and at the same time, they are using for treatment purpose. So in Ethiopian context, to define whether the product is a medicine or food supplement, we are defining according to the Proclamation 1112. Here is the other major thing, the medicine and food supplement. If it is a product is medicine, it is tax-free. But if it is a food supplement, it is taxed. If it is taxed, of course, the price is increased. So there is a change whether the product is a food supplement and the medicine related to the finance. When we come to the GMP inspection, on-site inspection is mandatory for medicine products, whether the facility is comply a good manufacturing practice or not, except stringent regulatory and authority has. There are some countries, their stringent regulatory authority is there, like Europe, North America, and other countries. But on-site inspection is conducted as deemed necessary for food supplement. The other thing is a prescription issue. If it is a medicine, unless otherwise it is categorized over-the-counter product. It should be prescribed by physicians, but a food supplement, no need of prescription. The other thing is advertisement. If it is a medicine, medicine cannot advertise unless we may conduct a promotion activity at the healthcare facility to the consumers or health professionals. But when we come to the food supplement, advertisement is allowed in accordance with the Food Advertisement Directive. But the selling practice, those are sold in a special retail outlet. Medicine is selling at the drugstore and the pharmacy. At the same time, a food supplement can retail at a special retail outlet. The other thing to define whether the MMS is a medicine or a food supplement, or the difference between medicine and food supplements, there are some products which are recommended as a medicine and as a food supplement also. For example, we can raise vitamin A, vitamin D. It is depending upon the dosage as recommended by pharmacopoeia, maybe that product become a medicine. And according to the recommended national or international standard, like a codex, if the amount of vitamin A or vitamin D is less, it is categorized as food supplement. The other thing, finally, is the label claim, especially the product, what the manufacturer say about that product. Is that a medicine or a food supplement? So in the label of the product, it is should be clearly stated whether that product is a medicine used for treat or mitigate such type of diseases, or the label claim as a food supplement. So when we are talking about the medicine and the food supplement, we are categorizing a list of such type of differences. Next, please. So just to give you a few highlights about sample of registered product, the food supplement. Currently, a total of 6,924 food registered and notified by Ethiopian Food and Drug Authority, out of which around 451 are food supplements. So there are a lot of food supplements which are registered by EFDA, like folic acid with vitamin B12, multivitamins and multiminerals, iron with multivitamins, folic acid, vitamin C and zinc. There are a lot of different products which are registered by EFDA currently as a food supplement. So to mention that is MMS is a food supplement or a medicine, we can see the lists before registered by EFDA. This is my final slide, just about the challenges. Before that, I wanted to raise one issue before the challenge about Dr. Ramadani is mentioned about the head of nutrition at UNICEF Ethiopia about the locally manufactured. Just to give you a few highlights, currently the government of Ethiopia encourage import substitution products. There is an institution under the Ministry of Industry which supports the manufacturers, Food, Beverage, Research and Development Center. So if MMS is locally produced, the Ministry of Industry will support. There is a center to support the manufacturers. There are a lot of agro-processing facilities also. So concerning the local manufacturing, EFDA is regulating the manufacturer. There is a requirement, a pre-license and post-license inspection guideline. But prior to regulate, there is a supporting institution under the Ministry of Industry also. So finally, I want to raise a few points about the challenges in food registration. As I mentioned earlier, one of the main challenges is borderline products. Some products are used for the treatment. At the same time, there is no active ingredient on there. Just only it is a combination of different food items like minerals, vitamins. So there are a borderline product. The other thing from the regulatory side, we have only 3 accredited food control laboratories one of the public, the other is a government, the private, and the other is EFDA regulatory body also have a laboratory. But we face a challenge for human power capacity for testing of vitamins, minerals. The other thing is the reference standard for vitamins and minerals for testing. So if we have a capacity, a lack of capacity, so finally, just to register or to import the product, we have to take a sample and send abroad. During all this process, the product may deteriorate or expired. So capacitating the existing laboratory is crucial. If we capacitate the laboratories, the existing laboratories, if we have a human power capacity, if we support the buying the reference standards for vitamins and minerals, we can check locally and we can release as a port of entry, or if locally manufactured, also we can get the laboratory test result. The other thing is the technical documents, which are very tough to present by the manufacturer, that is a stability study or shelf life study report. The other thing is product standard. We don't have any national standard. Currently, we use international standard codex. And sometimes there is no any standard because the product is prepared by special recipe. At that time, we are using company standard. So the lack of product standard also one of the challenge to the regulatory body. The other is the professional capacity, the product label also. Sometimes, you know, some food supplement manufacturers, they are saying the food supplement, but in the label, they are claiming the product is treated or cured such type of diseases. This is the other challenge. Another one is advertisement. If it is a medicine, advertisement is not allowed, but we want to advertise and promote that product, but only food, if it is a food supplement, it may be advertised according to the food advertisement directive. But if it is a medicine, we are not going to advertise. Maybe the promotion activity can conduct at the health facility level. In general, especially the laboratory capacity, the product standards, the professional capacity are the major challenges in the regulatory sector. Thank you for your attention.